This test will include 10 questions: ethics, boundaries, laws, regulations. 1 question: client assessment, reassessment, and treatment planning. 3 questions: guidelines for professional practice. 1 question: kinesiology. 1 question: anatomy and physiology. 4 questions. Question number 1. A client requests light pressure for her massage. However, during the session, the practitioner uses medium to deep strokes on a myofascial restriction in her back, explaining that the area needs to be worked out. This scenario illustrates what type of violation? Answer: A. Ethics. B. Confidentiality. C. Boundary. Answer: C. Boundary. Explanation: the practitioner is exceeding the client's requested level of pressure by applying medium to deep strokes when the client specifically asked for a light pressure massage, thus going beyond the client's boundary. Question number 2. A massage practitioner observes a client walking into the clinic and notes a lateral hip drop. The most likely muscle affected by this gait deviation includes: Answer: A. Gluteus medius. B. Quadratus lumborum. C. Rectus femoris. Answer: A. Gluteus medius. Explanation: the lateral hip muscles, including the gluteus maximus, gluteus medius, gluteus minimus, and the tensor fasciae latae, TFL, generate forces around the hip joint for both movement and stability, particularly in single-leg stance and during gait. Question number 3. A new client arrives with a diagnosis of thoracic outlet syndrome. Which of the following symptoms is most commonly reported? Answer: A. Numbness in the ulnar side of the hand. B. Cramping in the diaphragm. C. Achiness between the shoulder blades. Answer: A. Numbness in the ulnar side of the hand. Explanation: when nerves are compressed, symptoms of neurogenic thoracic outlet syndrome include numbness or tingling in the arm or fingers, pain or aches in the neck, shoulder, arm, or hand. Question number 4. A pain scale is used to assess. Answer: A. How much pain a client is experiencing. B. The client's pain tolerance. C. The client's nociceptor count. D. How long a client's nociceptors have been firing. Answer: A. How much pain a client is experiencing. Explanation: the pain scale is used to better understand a person's pain, such as pain duration, severity, and type. Pain scales help make an accurate diagnosis and create a treatment plan. Question number 5. A practitioner is getting ready to file taxes for their first year as a sole proprietor. Which of the following IRS forms are required? Answer: A. Schedule C. B. Schedule SEC, Form 1040 Easy. Answer: A. Schedule C. Explanation: to file your annual income tax return, you will need to use a Schedule C form to report any income or loss from a business you operated or profession you practiced as a sole proprietor or gig work. Question number 6. Which type of muscle is controlled voluntarily? Answer: A. Cardiac muscles. B. Skeletal muscles. C. Spindle muscles. Answer: B. Skeletal muscles. Explanation: skeletal muscles are attached to bones and are under conscious control, meaning you can intentionally move them by thinking about it, making them voluntary. Question number 7. How is skeletal muscle attached to a bone? Answer: A. Tendons. B. Ligaments. C. Dermis. D. Joints. Answer: A. Tendons. Explanation: skeletal muscle is attached to bone by a band of connective tissue called a tendon. The tendon acts like a cord that connects muscle to bone, allowing for movement when the muscle contracts. Question number 8. Massage therapy can reduce blood pressure by the stimulation of what? Answer: A. The circulatory system. B. The endocrine system. C. The sympathetic nervous system. D. The parasympathetic nervous system. Answer: D. The parasympathetic nervous system. Explanation: massage therapy can reduce blood pressure by stimulating the PNS, parasympathetic nervous system. This is achieved by decreasing cortisol levels and increasing serotonin and dopamine levels associated with feelings of pleasure. Question number 9. The meninges consist of 3 layers of tissue. Which layer is the thickest external layer? Answer A, dermis. B, dura mater. C, pia mater. D, arachnoid mater. Answer B, dura mater. Explanation. The dura mater layer tissue is the thickest external layer of the meninges. The dermis is a layer of skin, while the dura mater is the outermost layer of the meninges. Question number 10. Which neuron carries impulses to the CNS, central nervous system? Answer A, afferent neurons. B, connecting interneurons. C, efferent neurons. Answer A, afferent neurons. Explanation. Afferent neurons carry impulses to the CNS. Connecting interneurons transmit impulses between neurons. Efferent neurons transmit impulses away from the CNS. Keep studying.